Hello everyone, I'm Daniel and welcome to the Guided Mindset, which is a platform focused on providing simple answers to some of the most commonly asked health questions. And welcome to our series on high blood pressure medication. So after providing tips on how to naturally lower blood pressure in the past video, we talked about following up with that by providing a video that explains more about one of the most commonly prescribed high blood pressure medication class, which are the ACE inhibitors, your Lisinopril, your Enalapril, your Captopril, etc. Basically, any drugs that ends with Pril. And as you all know, high blood pressure can be managed with a variety of medications, including the angiotensin II receptor blockers, your valsartan, your losartan, the calcium channel blockers, your amlodipine, diltiazem, your diuretics like hydrochlorothiazide, your beta blockers like your atenolol, your metoprolol, and so many more drug class. And as you all know, all drugs do have their advantages and their disadvantages. And quite often, when managing high blood pressure, we often combine different class of drugs together to achieve the same goal, which is to lower high blood pressure. And for this video, our focus will be on the ACE inhibitors, and an example of these medications are Lisinopril with the brand name of Zesril, Enalapril with the brand name of Vasotec, Captopril with the brand name of Capot. And how this drug works is that they do dilate your blood vessel to ease the blood flow around your body, meaning that they do reduce blood pressure. And the primary use of this medication is to treat hypertension. That is, they do lower high blood pressure. And the other benefit of these medication is that they can be used in the case of heart failure with reduced ejection fraction. They can be used in the case of myocardial infarction. They can also be used to slow down the progression of diabetic nephropathy, which is basically kidney complications that can arise from uncontrolled diabetes. And some of the side effects of these medications is that they may result to hypertension when first taken, also known as orthostatic hypertension. Basically, like, this is the opposite effect of hypertension. And some of the symptoms associated with this is fainting. And very important, this medication do cause dry cough and angioedema, which is basically swelling of your face, of your ankle, or like different parts of your body. And quite often, like, when you experience this while on this medication, the best thing to do is to talk to your doctor for a medication change. And most likely your doctor will switch you from these ACE inhibitors to angiotensin II receptor blockers, which are the valsartan, the losartan, because these drugs do have the same function as the lisinoprils, as the ACE inhibitors, but they do not cause cough or angioedema. And a common drug interaction associated with ACE inhibitors with your lisinopril is that they do interact with NSAIDs, your ibuprofen, your aspirin, and these NSAIDs may reduce the effectiveness of this medication. And when this happens, it's quite important that you stay away from NSAIDs or try an NSAID alternative such as your Tylenol, your acetaminophen. Talk to your doctor for further guidance on which medication to take. And also, while on this medication, avoid taking potassium supplements because this medication tends to increase the level of potassium in your body, and you don't want to take extra potassium supplements as well, which can often lead to too much of potassium in your body. So it's best to stay off potassium supplements while on this medication, because this medication already is causing high potassium in your body. And a few of the contraindications for these medications is that they should not be used when pregnant, and also they are not as effective among African Americans compared to other races. And the reason for this is because this medication do have low efficacy among African Americans, among this race, meaning that it will work as well when compared to other race. And as a result, African Americans are often prescribed with hydrochlorothiazide to lower high blood pressure. And if you want to read more about this, there will be a link below that explains more on the clinical trial that was done specifically on this topic. And that comes to the end of this video. If you find this video informative, please like, comment, and subscribe. And if you have any question, please feel free to leave your question in the comment section below. And As always, please refer this channel to your friend. This is a growing channel. We are going to be covering more topics on hypertension, and also like more topics on other diseases, about like other drugs in the future as well. Thank you.